Zolpidem Tartrate tablets is a hypnotic from the imidazopyridine group, similar in pharmacological activity to benzodiazepines, which has effects qualitatively similar to those of other drugs in this group: muscle relaxant, anxiolytic, sedative, hypnotic, anticonvulsant, amnestic. Indications: treatment of transient and situational insomnia in adults with clinically significant severe sleep disturbance, including difficulty falling asleep. How to use: this drug is intended for oral administration. The recommended dose for adults is 10 mg per day. The minimum effective dose should be taken at not exceed a dose of 10 mg. Zolpidem is taken just before going to bed, already in bed, as its action begins very quickly. Zolpidem should be taken once and not repeated overnight. The safety and efficacy of zolpidem in children and adolescents under 18 years of age have not been established. Therefore, zolpidem should not be used in children and adolescents under 18 years of age. Due to the fact that elderly or debilitated patients may be particularly sensitive to the effect of zolpidem, it is recommended that such patients begin treatment with a dose of 5 mg. The daily dose should not exceed 5 mg. Long-term use of zolpidem, like other sleeping pills, is not recommended. The duration of treatment should be as short as possible, from a few days to 4 weeks, including a period of dose reduction. In some cases, it may be necessary to extend the treatment beyond the maximum periods, but only after a revelation of patient's condition. The following duration of treatment is recommended: 2 to 5 days for transient insomnia, for example during travel, 2 to 3 weeks with situational insomnia, for example due to a traumatic situation. Very short periods of treatment do not require gradual discontinuation of the drug. In the case of long-term use of the drug to reduce the possibility of developing rebound insomnia, the abolition of zolpidem should be carried out gradually. First, reducing daily doses and only then cancelling the drug. Contraindications: hypersensitivity to zolpidem or excipients of the drug, acute and or severe respiratory failure, severe acute or chronic liver failure, sleep apnea syndrome, pseudoparalytic myasthenia gravis, age up to 18 years, lack of clinical data, congenital galactosemia, galactose intolerance, glucose or galactose malabsorption syndrome, lactase deficiency. Special instructions: in all cases, before using a hypnotic drug, it is necessary whenever possible to establish the causes of sleep disturbance and carry out a correction, including medication, of the underlying causes. Persistence of insomnia during 7 to 14 days of treatment indicates the presence of primary mental disorders and or disorders of the nervous system. Therefore, to identify these disorders, it is necessary to regularly assess the patient's condition. Side effects: adverse effects, especially from the central nervous system, depend on the dose and individual patient response. They are more often observed in elderly patients, and their severity should theoretically be less when taking the drug just before going to bed or already in bed. Infectious and parasitic diseases: common upper respiratory tract infections, lower respiratory tract infections, immune system disorders, frequency unknown, angioedema, mental disorders, often hallucinations, agitation, nightmares. Uncommon: confusion, irritability, the frequency is unknown, anxiety, aggressiveness, delirium, anger, psychosis, behavioral abnormalities, somnambulism, sleepwalking, dependence that can develop even with the use of therapeutic doses of the drug after stopping treatment, withdrawal syndrome or rebound effects, libido disorders, sexual desire, depression. Nervous system disorders, often drowsiness, headache, dizziness, increased insomnia, cognitive impairment such as anterograde amnesia. The effects of amnesia may be associated with behavioral disturbances, which can also be observed with therapeutic doses of the drug, although the risk of its development increases in proportion to the dose. Frequency unknown, decreased level of consciousness, attention disorders, speech disorders, violations of the organ of vision, uncommon, diplopia. Respiratory, thoracic, and mediastinal disorders, frequency unknown, respiratory depression. Gastrointestinal disorders, often diarrhea, nausea, vomiting, abdominal pain. Liver and biliary tract disorders, frequency unknown, increased activity of liver enzymes in the blood. Hepatocellular, cholestatic or mixed liver damage. Skin and subcutaneous tissue disorders, frequency unknown, rash, itching, urticaria, hyperhidrosis, excessive sweating. Musculoskeletal and connective tissue disorders, often back pain, frequency unknown, muscle weakness. General disorders, often feeling tired, frequency unknown, gait disturbance, addiction to the drug, False, mainly in elderly patients and in case of non-compliance with prescribed recommendations for admission.